We should be live now.
Okay, so welcome everyone to Nottingham City Council's Children's Partnership Board. We've got a couple of things on the agenda today, so we'll start off with apologies for absence. Got any apologies, Michael?
Yeah, so we've got Elsa Barr, Erica Doran, and Catherine Underwood have given apologies. We've got Catherine Craner, Sarah Fielding, and Amanda Payne, who may be a little bit late.
Okay, thank you. And have we got any declarations of interest? No. Perhaps it'd be helpful if we just did some introductions. So I'm Councillor Cheryl Barnard. I'm the chair of this board, and I'm the portfolio holder for children, young people and education. So if we move to Michael.
Hi there. So my name is Mike Carey. I'm a governance officer, and I'm covering for Kath today.
Councillor Riaz.
I am Councillor Samina Riaz, Councillor for Woollerton and Lenton, and also Assistant Executive with Children and Young People, and a Vice Chair as well, I think.
Okay, Alison Smith. Has Alison disappeared? I think she might have done. David Johns.
Evening. David Johns, Deputy Director of Public Health in Nottingham City Council.
Eka Gansa.
Hello, good afternoon. My name's Eki Ganser. I'm the Child Friendly City Lead for Nottingham.
Julia Bramble.
Hi everybody, my name's Julia Bramble. I'm the Service Manager for Early Help and the Lead for Family Hubs in Nottingham City Council.
Elizabeth.
Hello, I'm Elizabeth Richardson. I'm Head of Safeguarding at Nottingham City Care.
Maria.
Hi, I'm Maria Ward. I'm here on behalf of Maintain Primary School Governors.
Nicola Rose. You struggling, Nicola? Do we go to Nikki Bridges while Nicola's trying to get?
Hi, I'm Nikki Bridges, head teacher at Robin Hood Primary School and primary school representative.
Nicola, are you able to speak? No. Alison.
Hi, sorry about that. Lost a bit of connection. Alison Smith, I'm the service manager for the advocacy service from Change Grow Live CGL.
Okay, I think Nicola's managed to join on audio. I think Nicola's still struggling. So we shall go on to the minutes of the last meeting. So I hope everyone's had a chance to have a look, but we'll just go through each page, checking for matters of accuracy and any minutes arising. So page 1, page 2, page 3, page 4, page 5, page 6, and that's it. It's yeah, I think that's it for the minutes. Can we agree those as an accurate record of our last meeting, please? Yeah. Okay, I'm seeing a few nods there. So I'm going to now pass over to Elizabeth for a presentation on Change Grow Live advocacy service. Elizabeth, over to you.
I think that's over to me, Councillor Barnard.
It's not me unless there's another Elizabeth.
It is Alison. Sorry, Alison.
Yes, sorry. Morning. Hi. Thank you. Yeah, so I'm the representative for Change Grow Live. I've service managed the advocacy service. Change Grow Live took over the contract for advocacy in October of 2022. So we've been running just over a year now with the contract. The contract as it stands is that we provide advocacy to all the children in care looked after in residential homes and in foster placements. So we provide 2 levels of service to them. Residential visiting advocacy is that the advocates go visit all children placed in residential care, irrespective of their location across the country. And that occurs either virtually or in person every 8 weeks. If that young person has complex needs or complex disabilities, then we do a face-to-face visit every 4 weeks. So that's the residential visiting advocacy. Alongside that, we have issue-based advocacy, which is where young people raise issues with their advocate, and the advocate and the young person agree a strategy to deal with those issues and work with other agencies to resolve that young person's issues. We are young. Sorry.
Would you like the presentation to go up? I think Michael can probably put it up.
Yeah, that'd be great. I can go through those really, because that really relates to how we work. So this year, the graph on the first screen, I'm not sure whether you've got that up, Mike.
Not just yet, I'm just finding it now.
Okay. So yeah, the issue-based advocacy is obviously a child or young person-led service. We are led by young people. We work for young people. We're an independent service. Outside of a safeguarding issue, everything we discuss with them is a confidential issue, with the exception of safeguarding, of course. And we look to try and resolve those issues for those young people in a timely way. You will see from the graphs when we get them up that this year, from October 22 to September 23, there were 94 direct issue-based pieces of work. And the vast majority of those referrals were raised by young people directly themselves, which shows that the residential advocacy works very well on the basis that the advocates build up positive relationships with their advocates, and because they're very consistent in their process, really, and some of the young people have remained with the advocate for the last 5 years, irrespective of the Change Grow Live taking over the contract. The advocates have moved with the contract. So the advocates have known young people for a very long time, and that shows in the number of referrals that we get, which are raised directly with their advocate from those residential visits. So you see the peak when we first we took it over, Change Grow Live, the transition showed that 24 young people in October to November raised issue-based pieces of work, which was a follow-on really from the transition of the services from Children's Society to Change Grow Live. And then it's a pretty consistent monthly issues that are raised by young people, sort of between as low as 3 but up to 11, which is a general response really for young people. Social working referrals. So if you go to the next slide, please. This shows the referral routes. So as you can see from the blue, they're the referrals that have come in directly from young people themselves. The red line shows the number of referrals from social workers, which is fairly low. We obviously have experienced vast changes in social work teams and social workers with young people. So the number of referrals that come in is in peaks and troughs, which is fairly low. Where we've had the increase in March, April, this is due to the fact that we took on a pilot for joint housing assessment for young people who were being presented as homeless. So we've taken on a pilot, and the referrals that have come in for advocacy referrals for joint housing assessments have come in on those peaks, basically. So if you go to the next screen, please. This referral by age shows the biggest group of young people by far are the ones between 15 and 17. This pretty much follows the trend of looked after children, the process of looked after children. We have seen an increase of younger children coming into residential care. So as a response to that, we are seeing 7, 8, 9-year-olds coming in with issues, being placed in residential care. And obviously the red line shows the 11 to 14-year-olds that come in. The number of referrals for care leavers is fairly low. Most of those referrals are around transition. So next slide, please. These are the types of referrals that we have. The vast majority of the referrals are young people wanting us to represent them or support them during their LAC reviews, a representation of their wishes and feelings, which is the one that follows that graph, the red line that follows below. And education is also highly recognised for issues for young people either wanting to change schools or change placements or requesting more further support in education. So we see quite a lot of those. Issues can vary. We often go with one issue and then those issues move into multiple issues. We've got a line, the yellow line shows the complaints that have got, which the advocates support young people with. Requests for new social workers also comes in, and request for placement changes are fairly frequent. A lot of those are as a result of young people being placed out of county. And I think the next graph shows the amount of young people who are placed out of county is about 40% of the young people that are placed in residential care at this moment in time are actually out of Nottinghamshire, Nottingham City and Nottinghamshire, which is a fairly significant amount of young people. I think that's it. The service was commissioned to advocate, as I've said, for young people who present as homeless. That was initially a pilot for 6 months, but has now been extended for the year. Currently, we've represented 17 young people in joint housing assessments. That's it. Thank you very much.
You want to take the screen down, Michael? Yeah, and then I'll open it for questions. I've just got a question before I ask other people, because some of the places on that the slide on where children are placed.
Yep.
Some of the areas are areas in the county.
Yep.
That aren't under the NOTS one.
Yes.
Like Newark and Long Eaton stand out that way. Yeah.
Yeah. Yeah, there are on the peripheries. I mean, Nottinghamshire obviously is a very large county, so young people are placed all over Nottinghamshire, as they are in other counties, unfortunately.
Yeah. Okay, and Sam, you've got a question?
Yeah, just coming back to that slide about referrals. I note that you've said that actually the number of referrals coming from social workers aren't perhaps as high as you would perhaps expect. So I'm quite happy to take that back to my colleagues if you think that would be helpful,
Super,
just to remind them.
Yeah, thanks, Sam. I mean, ultimately, I'm working currently with some heads of service with plans on promoting the service again. There has been huge changes in social work teams and social workers, and I think that sometimes the message gets lost in translation. So it is about promoting that service again. But at any point, we have commissioners' meetings every quarter, and we ask for that to be rolled out every quarter, but it doesn't seem to happen very often.
Okay, well, we can do a pincer manoeuvre, can't we? And
yeah,
I'll raise it within our leadership
any
team and take
promotion
it
is
forward.
great. Promotion, thank you. Yes.
Yeah, I think we need to make sure that social workers are aware. I know we've had a lot of churn in the teams, and again, that consistency and building up the relationship with the child hasn't always been there. So I think that's important as well. Nikki.
I think it sounds like a really interesting service, so thank you for what you're doing for the kids. But again, it kind of feeds into the communication angle. How do children going into care know about the service, and how well kind of communicated is that, for example, to schools? You know, I've had children that have gone from my school into care over the summer holidays and things. How would we support them with this service?
So, as part of the package, so when we were commissioned, leaflets and flyers of what the advocacy service is should be part of the package given to that young person by the social worker once they're going into care. So unfortunately, the service can't get out to all those young people who are in foster placements. So, you know, I do worry sometimes that they aren't aware of the service. There is a leaflet. The leaflet should be in those packages that go out via the social workers, but I'm not convinced that happens.
It would just be really interesting, wouldn't it, to kind of, you know, speak to some young people going through this process and work out what the reality of the situation is for them in terms of what they know about.
Yeah, I mean, they should be given their rights as a young person. Once they enter a looked after process, they should be given the opportunity to be represented by an independent advocate.
Okay, thank you.
I would guess that children in our residential homes know more about
Absolutely.
it.
Yeah. I mean, all the residential homes have pictures of the advocates that are allocated to those homes. So all the homes that I get notified of where young people are have our posters in there with the photograph of the advocate who is their residential visiting advocate. Where young people have been in care for quite a long period of time, invariably the advocate that they had previously, and if they move home, moves with them, especially if they've got a very good relationship with their advocate. So one of the consistent things about our service is that the young person can remain with the same advocate for years, throughout many changes of social workers, unfortunately. So it is a good opportunity for those young people to have that link, if you like, and that relationship.
Yeah, it is really good that advocate stays with the child, I think. Yeah. And do you get requests, I can't remember seeing it on the slide, to attend EHCPs or anything like that?
Yeah, we go to a lot of that comes under education, really. We do a lot of meetings for the young people. We're obviously driven by young people, and we will attend with them for any meeting, legal meeting, meeting with solicitors, EHCP plans, LAC reviews, secure reviews. We attend any meeting that the young person asks us to attend with them.
Any more questions for Alison? I'm not seeing any hands up, so can I just thank you, Alison, and please pass our thanks on to the team, because it's a really important service that they provide for our children, and we very much appreciate it. And I think we need to look at how we can check what children, the broader spectrum of children know about the advocacy service, and how we might be able to get that out to schools and get that information out. So we need to make sure that children and teachers that have got any concerns about children who are looked after can help them to access the service.
Yeah,
so
that'd be great.
We'll take that away, and yeah. Okay, so we're moving on to the next agenda item, which is our early help partnership. So passing over to Julia and Ronnie, I think, for this. Do you want the slides putting up, or are you able to do that, Julia?
If Mike doesn't mind doing it, that would be great. Thank you.
Yeah, I don't mind.
Just because of Zoom technology, it might take me a few minutes to get them up.
Lovely.
Thank you.
Lovely. Thanks, Mike. If you could just pop to the next slide, please. So, good afternoon, everyone. My name's Ronnie Fairley, and I'm the Supporting Families Coordinator. Today, Julie and I are pleased to share with you some of the developments and changes that we've been supporting in early help and across the partnership. Supporting Families programme, formerly known as Troubled Families nationally and Priority Families locally, our programme underwent significant changes in 2021, and this was in response to some of the challenges posed by the post-COVID impact. The programme now recognises some of the issues that families are now facing, and the programme has expanded the focus to include a broader range of themes and concerns, making our programme and our approach even more holistic and inclusive. The expansion resulted in our programme growing from 6 to 10 key areas of focus, and it reflects our commitment to adapt and respond to the evolving needs of the communities we serve. Within Supporting Families, we have accredited practitioners from various partner organisations. These backgrounds include expertise from schools, Departments of Work and Pension, police, CAMS, health, education, welfare, housing, didn't want to forget housing. And this diversity of expertise allows us to provide comprehensive and tailored support, and to support our colleagues from across the partnership to address some of the complex and interconnected challenges the families may be facing. The accredited practitioners actively contribute to the transformation of our services, which is one of the second of our 3 themes. Not only providing supporting role for our partners through the assessment plan and lead professional role, but also they support adapting and the more streamlined processes and hopefully facilitating quicker and easy support for families. The collaborative approach in these transformations are ongoing, and we're currently enjoying a robust partnership with stakeholders who share common commitment to working together. Julia will provide a bit more insight into that later on in the presentation, and will elaborate more on some of the developments within the partnership. The third pivotal role of the programme centres around data maturity, and this involves the development of a partner portal for our partners to be able to record their assessments and plans, and a focus on appropriate data sharing. As we continue to evolve and refine our strategies, these 3 pillars, whole family working, transformation of services and data maturity, remain at the core of the programme, and together they form a robust framework which we've been using to create a positive, lasting impact for the families that we serve. So if I just take you on to the next slide, which is kind of where our journey really started to take and move forward. In March of the year, we held a whole family and early help partnership workshop. There was approximately about 47 different partner organisations, and this also included some families represented there as well. From the actual workshop that we held, we formulated the results and what the partners were saying to us, and we established an early help partnership steering group in June 2023, and bringing services together to help us to formulate towards an early help partnership strategy. As you can see there, This isn't a total list, but we did have local authority representation, ICB, public health, education colleagues, police, city care, voluntary and community service representation, housing, and the DWP. And from that, that's where our journey then took us towards that early help partnership strategy, which I'm going to move to the next slide, which Julia will now pick up.
So as part of our commitment to co-production and consultation with families to develop our early help strategy and the work that we've been doing through the early help partnership steering group, we gathered the views of young people's and parents, asking them what does good early help look like to them, to find out and make sure that we were developing a structure that met the needs of Nottingham families. So I should just give you 2 minutes just to read some of the comments, but it made sure that we were working to the needs of local families. Go to the next slide then, Mike. So the agreement of the steering group was when we were looking to develop practice principles, that the group agreed to adopt the practice principles from the Children's Integrated Services department of the local authority, because they said what everybody wanted to achieve through the steering group, that being that children and young people are at the centre of everything that we do, that we start and finish the day with them in mind. Really powerful principle for the whole partnership to be working towards, that we build on strengths and we value relationships, that we partner with families and professionals to support parents and carers to ensure children and young people are safe, happy and reach their full potential, and that we recognise and celebrate difference, that the help we offer will be based on what works and undertaken by creative, skilled and supported practitioners. So those are the practice principles that have been adopted from Children's Integrated Services, but adopted by the Early Help wider partnership. We'll go to the next slide, please, Mike. So then we agreed as a steering group 5 priorities that would be worked on and achieved within the next 3 years. If I'll let you do the first 2, Ronnie.
Yeah, sure. So obviously embedding a whole family system approach to facilitate the early help is part of that whole family working, and the partner portal that we're currently built. Well, it's built. We're just getting the final security measures in place where we can open that up to our partners. Our partner's been involved in some of the testing of it and the development of it. And hopefully in the not too distant few weeks, that will actually be launched. And that will also, you know, fall in line with the promotion of the threshold of need document that we want to do within this priority, and develop shared language and embed that whole family working. In priority 2, the partnership working is supported by our colleagues within the accredited practitioners, and again, promotion of all services via Ask Lion. And I don't think we've mentioned it yet, Julia, but our early help partnership website that's also been launched. I think also within this priority, we're hoping to improve our co-production collectively. I think we've got some really good practice that we're already doing, and that, you know, we can start sharing more collectively. That is definitely a focus within this priority, and developing and sharing good practice.
So then priority 3 was moving on to the whole partnership workforce, looking at how we can support development across the partnership and develop a cohesive structure. So the areas that we are working towards are ensuring that there is alignment and that the partnership is effective in meeting the needs of local families. Looking at the language that's used across different service areas, identifying gaps and supporting access to services. Developing and delivering a partnership-wide induction, training and refresher package. Again, that's really important as we look towards an early help partnership approach, that everybody is aware of each other's service areas, what support can be provided to families and how to access that support. To enable that, it will include a programme of shadowing opportunities across the partnership, and then delivering 6 monthly multi-agency events to celebrate achievements and embed a collaborative approach. Priority 4, measuring the impact of early help. There are 2 key drivers within the Early Help Partnership that are grant funded drivers, one of which is the Supporting Families and one of which is the Family Hubs, both of which have a key partnership approach to early help services and bring on board many of our key partners who provide services for families. What we're looking to achieve are establishing some joint key performance indicators and developing a system to evaluate the achievements and the areas that require further development across the wider partnership. And the final one, priority 5, is looking at pooling funding and identifying sustainability opportunities with the Family Hub and from other external funding sources. Both the Family Hub funding and Supporting Families funding are short-term external funding, grant funding. So what we're looking at as we're working through the different priorities within the strategic group are seeking out joint commissioning opportunities, looking at actively supporting each other within the partnership to apply for funding to increase the early help offer for families, and continue to make the case for continued long-term funding and investment in early help and prevention services. If we could go on to the next slide, please. So what has been achieved so far? The steering group and the partnership have developed an early help partnership strategy. That's what it looks like, and you've got a link to the strategy and a QR code to the strategy. The strategy is embedded within our website, so it is accessible for families, for partners to look at what has been agreed that the partnership will be working towards. And then if we could go to the next one. And then moving on to a little bit of further detail about Nottingham's Family Hubs and the achievements to date. So the next slide should take us to the website. So this has been a significant piece of work across the partnership, funded through Family Hubs, to create a website for families and professionals that contains both information, advice, activity details, and links to partner websites for whole family services through the partnership. We launched the website on the 30th of October. We monitor the content of the website through the wider partnership, and we will be including more information as families and partners tell us where there are gaps. But it's the idea of it is that it's not just a service directory. It complements the information that's available on Ask Lion, but the partnership website has a real partnership approach. So if a family is currently expecting a baby and are requiring antenatal services. If they've got a 2-year-old and are looking for information and activities to support around the transition from breastfeeding to weaning, looking at groups and activities. If they've got a 5-year-old and are looking for support in positive behaviour, looking for activities outside of school, looking for support for a 15-year-old, they should be able to find links to all of that information from this one website. So again, you've got a link to the website and a QR code to the website. Please go and have a look, and get in touch if you find anything that we can add to it to continue to improve the website, to make sure it contains information for the whole family and the whole partnership. As it stands at the moment, we're just working through some of our accessibility elements. We do have translation facility throughout the website, but for some of our PDF documents that have been uploaded, there's additional work that needs to be done on those that we have a deadline of the beginning of next year to achieve. If we could go on to the next slide. So just as a bit of a reminder for everybody, that the Family Hub grant funding supports some funded service areas, but also promotes wider service areas. So the funded service areas are to create a Start for Life offer. That Start for Life offer is information from conception to a child's second birthday. So all the information that families may need, whether it be their first pregnancy or whether it be a subsequent pregnancy, or a family that's just moved to Nottingham City and isn't sure what services are available locally. Again, it's a partnership approach to bringing that information together into one document that we're due to review the electronic version at the beginning of next year, and then we'll go out to print to have paper copies that midwives will be distributing in hospital to all new parents. One of the second funded area is infant feeding, supporting public health campaigns to promote infant feeding, to provide support for parents who aren't sure or need additional support to maintain infant feeding or establish it at the beginning. The way we're doing this is increased support through both city care provision as well as peer support development so that parents have a choice of where to go to for support, if it's another parent or whether it is a professional infant feeding specialist. The third area that is funded is perinatal mental health and parent-infant relationships. Very much the powerful impact of positive bonding and attachment in the first 2 years of a child's life is well documented, about the impact it has through subsequent years. So the support that is being developed there is coordinating the many perinatal mental health service offers that are available, both funded through the NHS and through community development, as well as enhancing and increasing the capacity of Nottingham's Healthy Little Minds team, which was initially funded by Small Steps Big Changes, but has expanded through the Family Hub funding. The development of parenting programmes for parents with children aged 0 to 2 years. So there is a whole host of parenting programmes for parents with children aged 2 years plus available across the partnership, but there was a significant gap of parenting programmes for the 0 to 2 year age bracket. So there are several in-person and online programmes that are currently being established and going live now, and others that will be going live in the new year. And the final funded area was home learning environment. So this is supporting parents as their child's first educator, with confidence, with accessibility to resources to support their child's learning at home, alongside access to nursery provision for children from 2 years plus. So confidence is what parents tell us is one of the most challenging barriers, as well as accessibility to books, to activities, to resources, to engage in activities with their children at home. So outside of the funded services, there's an expectation through Family Hubs that we increase the wider services that are available to families to ensure that we move from the previous children's centre offer, which was focused on 0 to 5s, to a whole family offer from 0 to 18 or up to 25 for children with disabilities. And some of the new offers that have been developed over the past 2 months are weekly drop-in sessions from our Department for Work and Pension colleagues, who are offering families with better off calculations, financial stability advice and debt advice. And those are weekly drop-ins at each of the 4 family hubs. A community perinatal mental health assessment session. So rather than parents who are struggling with depression during or post pregnancy, having to present at their GP to be referred to perinatal services, there is a self-referral point currently being delivered at the Meadows Family Hub, where families can go and speak directly to a perinatal mental health nurse and receive an assessment looking at what is the most appropriate support available to them, and have that in person rather than it being online. Oral health packs are being distributed through the family hubs for any family that needs resources or information about positive oral health. And just a quick case study on that, it's our Southglade, our Bestwood family hub. We had a young person that was 12 years old that had come in after school to get a drink and just spend some time in the building, and saw toothbrushes available on the reception desk. Asked if he could take one and was told, yes, help yourself, choose whichever colour you want. And his response was, oh, that's really great. That means I don't have to share with my brother anymore, which is a really sad instance in today's society, that every child doesn't have their own toothbrush. So oral health packs are available in every family hub and are given out to anybody who isn't able to afford toothbrushes for each child in their family, along with toothpaste and oral health advice. If you're aware of any families who need that support, then just ask them to drop in. We also have, starting in January, 2 sessions delivered by the NSPCC. One is Pregnancy in Mind, which is a antenatal support session, and the other is Domestic Abuse Recovering Together, which is a support session for parents and their children. And we're looking at a pathway that, following access to the Freedom Programme, then the Domestic Abuse Recovering Together will work alongside that as ongoing support. And we also have, coming in the new year, some housing solutions drop-ins in each of the family hubs to mirror the Department for Work and Pension drop-ins. And we'll go to the last slide. So I've just given you the details of the 4 family hub sites that we have in the city. Families can contact any of those sites, as can professionals, or families can walk in to any of the 4 family hubs in the city. And those are the main sites, but family hubs are a hub and spoke model. So we also deliver services out in communities and in areas of the city that don't have a family hub based in them. So we're delivering services in Clifton, we're delivering services in St Anne's using alternative community venues. There are sessions being delivered in school buildings, in community centres, in libraries, covering the whole city using the capacity that we have, as alongside a virtual offer. And that's the last of the slides.
Thank you, Julia. It's really good to see that developing, that idea that, you know, there's lots of different organisations that are part of that early help offer, and it provides that integrated support network for families. And then with the family hubs being somewhere where people can come into for that, you know, if they're looking for support. But I think we need to get those, the messages out about the early help partnership website. I'll make sure that that's sent out to all councillors so they've got that information and they can spread the word a bit. Have we got any questions for Julia or Ronnie?
Just while we're talking about the comms and marketing for the website, Councillor Barnard, we are currently in the process with design and print team, and are having 50,000 postcards printed as soon as we get sign off, but it's grant funding, so we're hoping that that will be going through, where we will be delivering to every school, every health centre, every GP surgery, every police station, all of the family hubs, so that parents and partners can access a postcard with the direct link to the website, and the information in 5 different languages as well. So accessibility of information about the website will be going out very early in the new year across the wider partnership, where we have a significant amount of postcards available to be given to families.
And it's really good that we're moving with the times and we've got the QR code, because a lot of younger parents would prefer that, as opposed to, they don't have a pen and a piece of paper with them a lot of the time, but they've got the phone, they can scan in that QR code. I've got Catherine Craner wanting to come in with a question. Catherine.
Hi, can you hear me okay?
Yes.
Yeah.
Oh, thank you. Firstly, my sincere apologies for being late to the meeting. I was delayed in another meeting. But it's a bit of a comment really, and a question for Ronnie. So obviously we have a PCSO seconded into with you, and I know the evening session. I was just checking, Ronnie, that you felt that our partnership was working well, that we were getting the referrals and supporting with the programme.
So in lots of the, just checked I was on mute. So we've just literally started and trained all the new PCSOs last week. They were the first ones onto the programme. We've got a reinvigoration now in terms of the whole family working across the partnership now that the assessment's been done, the plan, etc. The contribution the police have always made to the programme has always been first class. I mean, the sponsor right at the very beginning was the police that sponsored the programme, and the support that we receive has been not only welcomed locally but actually nationally. It's recognised, and on many occasions Nottinghamshire Police has been held up in terms of being first past the gate, so in terms of the DPIAs etc, and helping to support the programme, make sure that we are achieving outcomes that we should achieve. I've got no complaints whatsoever, Catherine.
Oh, that's really
going really well.
Thank you. And yes, good to get some of our new starter PCSOs trained up as well. So thank you.
Thank you.
Maria?
Hi. Yeah, I'm really pleased that we've moved this far with the family hubs. It makes sense to have a wider involvement, I think, with the family, and we've always known that. And family hubs have given us the opportunity to be able to do that. I know there are lots of partners sat around the table, schools, police, lots and lots of different people. I want to try and ensure that you get to those people that are not necessarily involved with professionals. So it's great having the information in schools, but why don't we go a little bit further than that and get it out to the voluntary sector? What about those people? Have you explored working with some of the community partners like the co-ops and the Tesco's and things like that, to be able to have those things on their community notice boards where people go all the time. You know, I'm not. I think you're doing an awful lot to get it out there, but there are other places that we can consider, and and quite a lot of people who are working with those communities within the voluntary sector are more likely to come across the families that might actually need this. And my other question, I'm sorry, is very much about the employment and skills aspect of this. So I know that from looking at family centres, family hubs across the wider area, not just Nottinghamshire, but wider afield than that. Many are going for up to 25, whether you have special educational needs or a disability or not, and recognising that that period between the child's 18 to 25-year-old is a difficult period for them and parents. How are you working with the idea of the youth hubs that are being developed by the DWP, because they will be looking to work up to 25 to 25? So are you considering more partnerships there? Sorry, that's a lot.
And there are so many. There are so many different hubs being developed throughout the city, Maria, that we want to make sure families that there are good links between the different types of hubs. So we've got our health hubs, we've got our youth hubs, we've got the family hubs. We need to make sure that there is good linkage between each of those hubs. So if the family hub, if the family hub isn't the right venue, we won't turn families away, but we will find the information about where their nearest the right hub is for them. So there's a lot of work being done. What we don't want to do is duplicate work that one hub is focused on and has funding for, where we don't want to duplicate that work. So it's about that greater understanding. I totally get, do you know what I mean? And working with community and voluntary sector is absolutely crucial for making sure that we reach all of Nottingham's families. We're in the early stages. We're not the experts on that, but we're starting to really get our links out to our wider communities. So Muslim Women's Network are part of the operational group for family hubs. We're linking with the Ukrainian family support services. So we're linking, but that's only a small proportion of Nottingham residents. So we know we've got more work to do. There will be a huge stock of the postcards available for any partner to come and collect, to distribute, or to send us the a mailing address that we can make contact with to make sure that we explain what the postcard's about so that they can give them out. We're not reducing the number. We've over ordered so that we can make sure that hopefully every family will get one from some point in the community where they do access.
And just thinking about the comments Maria made about the age range, and I know that we go up to 19 and then 25 if there's any special educational needs or disability. Are we getting a range of ages? I've heard you mention a young teenager coming in and having an oral advice and toothbrush, etc.
So in some of our family hubs, there's more youth access than others. Mostly it is for appointments. So they will see their tutors for those children that are not in education. They'll meet their tutors within the family hub buildings. They'll have access to CAMS appointments within the family hub building. We have young parents groups running at 2 of our sites that are for teenage parents up to the age of 25. So we're supporting youngsters who are also parents, and that is both for their own emotional well-being as well as their role as a young parent, which are well established groups and well accessed at our Southglade Bestwood site. I think there's 25 attendees on a weekly basis. At Meadows, it's dropped recently, but there were up to 15 attending per week. Earlier in the year, I think it's dropped to about 6 at the moment. So there's more work being done as to whether it is the right site for them, because not everything has to be delivered from the family hub buildings. It is a partnership family hub offer that's delivered from numerous different sites. So for some young people, they want to come into a building to access sexual health advice. For others, they wouldn't want to come into a family hub building in case they bump into mum's best mate with their toddler. They don't want to be seen. So we're taking feedback, we're doing consultations with young people to see what services they do want, but to make sure that those services are in the right place and not necessarily just in a family hub building. But we do have agreement that as and when service need increases and the number of partners that want to deliver services for young people, that there will be availability to expand opening hours. So family hubs won't necessarily be a Monday to Friday 9 till 5 centre, that there's the opportunity we've built into the budget, caretaking, cleaning, additional hours, reception additional hours, to make sure our buildings are accessible into the evenings and at weekends to meet the needs of whole families who don't want to access or can't access services Monday to Friday 9 till 5. At the moment, we haven't had those requests, so it's not in place yet, but it's because the need hasn't created that requirement to open those additional hours yet.
Yeah, it's great that we're getting the young people's voices and we're trying to find out what they want from the service and what they want there. Can I just ask whether there's any liaison with other authorities where there's family hubs to see what they're doing and compare and contrast, etc.?
So there are regional family hub meetings, both for the East Midlands and then wider across the whole Midlands. I've actually been to one of those meetings today where we were sharing information about co-production, how different local authorities had managed to achieve different levels of co-production and what were successes in some areas and not success, but learning areas for learning in different local authorities. Obviously, through SSBC's development of a co-production model in Nottingham, we have a very good baseline for our co-production model to mirror that and replicate. And there's lots of work happening between myself and SSBC looking at that sustainability of that model through family hubs so that it's not lost and that our key parent champion roles can continue to grow rather than coming to a finite end at the end of SSBC. So there is lots of learning that's happening across different local authorities, and one of the points that was developed or was shared through Leicester Family Hubs this morning was the development of community fridges. That I think is something to share with our operational partners as to whether that's something that they would want to see expanded in Nottingham. So an increase of food bank opportunities without having to have a food bank referral, bring and buy second-hand clothes, equipment, toys, etc. Is that something that we have the appetite for in Nottingham to be delivered through family hubs, but also is there the capacity through our voluntary sector to coordinate something of that scale, where they'd got, in Leicester, they've got 4 volunteers at each of their sites on a rota to man the community fridges where parents can come and take food, take clothing, without having to go through a referral system, but also linking to food banks so that if there's any, make sure there's no food wastage on a Friday afternoon when the family hub shuts, that they can pass that food on to other food banks providers that are available at the weekend. So there is learning, and there's different ideas to take. I'm not sure that Nottingham would want every one of the ideas, but it was great to hear the success of that service in Leicester.
That's great. Really good to hear that. It's community fridges, something we talked about when we had the joint initiative with Fair Share and Friction, using our kitchen and Sainsbury's providing some things. And the idea was mooted then about, you know, maybe having community fridges out in the community where people could come and get food at low cost or zero cost. Yeah. Well, I'm not seeing any more hands, so can I just thank Julia and Ronnie for a really interesting presentation, and I'm sure you'll be back to tell us how it's developing later along your journey, but thanks for everything you're doing for our families.
Okay, you're welcome.
So moving on, we've got now key messages and items for information. So has anybody got any updates for partners? Not seeing any hands. So we can go on to item 7, which is the forward plan. And my other computer's gone to sleep now. Right, so so in March we've got the Ofsted update and school attendance, which will be the priority education investment area presentation. Just I've just thought of a key update. We have had our 3rd monitoring visit, and the outcome of that will be published in January. What date in January, Sam?
It's Friday the 12th of January.
So that visit concentrated on our care leavers. So we're expecting that report to be published on the 12th of January. So I think we're on to any other business. Any other business from anybody? No? Well, can I thank you all for your attendance this afternoon? It's been really interesting listening to what's going on, and thank you, and all have a lovely evening. Thank you.